Hi, I'm really lucky today that I've got an old friend of mine, a long time ago, and his name is Doug Cresswell. And for me, he's been one of the sort of inspirational people in supported employment. And I just wanted to have a chat with you, Doug, and sort of take you back. It's quite frightening. It's so when the time when we actually had decent hair and it was the
Hey, there's
80s and
nothing
we
wrong with this hair. Don't be
no, I know.
silly.
Look at mine now. And just sort of go back a bit and ask you, I remember, I think, meeting you in Stockport when I did a little tour around it. I think it was around about 1987 and 1988. I was trying to wreck my mind of, but just to talk to you about how you started off in supported employment.
Okay, it will have probably been, Robert, 1988 that you came to Stockport. I've got to be honest, and I'll be honest throughout this. My memory's not brilliant, so there may be bits here that get added that aren't exactly factually correct, but I think it was about 88. So, it was a strange route into supported employment for me. A little bit of time is probably worth explaining. So um, I'd worked in industries that had been around finding people work. So I'd actually worked in job centres. I'd worked in a careers office, something called an employment assistant, where we were trying to get young people through the various schemes that we had. Like they were called, well, I used to call them hop, skip, and yops, but they were called work employment programs, all the usual stuff, still going on then. That was probably in the early 1980s. And alongside that, this is the bit that just shows you how chance plays its role. Alongside that, I was in the evenings, I was a DJ, and I was DJing in clubs and places in Manchester. And through that bit of my life, I'd got into a brand new hospital radio station that was opening in the Tameside area of Manchester, and through that, I got to meet a lady called Joan Ryan, who was at that time the volunteer services coordinator for the hospital where the radio station was based, but later left that job to get a job as something called a pathway employment officer.
Was that with
Working,
Mencap?
yeah, the Mencap Pathway Employment Service. And Joan was working in that role for Manchester City Council. And through the hospital radio, I knew Joan as a personal friend. And I was at that time languishing in this job in the careers service, which I wasn't a careers officer, as I say, I was an employment assistant, which I preferred because the employment assistants tended to be employed to try to work directly with young people, to try to get them directly into employment, alongside admin duties as well. Having worked in the job centre and the career service, I knew there was something fundamentally wrong with the way that we were trying to get people into work. It didn't see things through. So you'd put somebody forward based on a card that they saw on the board in the job centre or the career service. And actually, that was it. You'd wave bye-bye to them, and they were then very much left on their own. It occurred to me that anybody really who needed a bit more help than that, there was just nothing available for them. So when Joan got this job with Mencap, working with people with a learning disability for the city council, I was intrigued, to say the least. I thought this is an interesting model. And around 1986, it will have been, she made me aware that there was a similar job coming available in Rochdale in Manchester, and suggested that with my background, I should apply for it. So I did apply for this Pathway Employment Officer job in Rochdale, and I never got it. A lady called Jocelyn Munslow got that job, who'd also worked in the career service. But a few weeks after being told by Mencap that I hadn't got the job, I got a phone call to say, but there's a job coming up in Stockport, which is where you're currently working. So you would know the area, and we would be very interested if you would apply for that. So I did. Actually, this will have been 1985 I applied, Robert. I got the job and I started as Stockport's Pathway MENCAP Employment Officer in January 1986, literally in January 1986. And I think there were about 17.
You started then about 6 months before me at Blake's.
Right. Right. Well, at that time, Robert, of course, the Pathway Employment Service, they had about they had about 17 services currently running throughout the UK.
It's unusual because your journey is not dissimilar to mine. I worked at Tooting Job Centre, so that's how I started. I worked at Tooting Job Centre, and I had similar ideas. Do you remember they had those sort of assessment centres that if someone was disabled, they would send them to an assessment centre?
Rehabilitation centres.
Yeah, and I was absolutely horrified because I went to this assessment centre where I met this man, and he got the usual beards and sandals, and he was saying, well, and I said, well, what happens? Says, well, you send them here, and then we assess them whether they're capable of work, and the work that they were doing was old-fashioned factory work that no one did. And I said, well, how does that work? He said, well, no one wants them to be assessed for work, so we just assess them for being not capable for work, so everyone is happy. And I went away from that, and I remember talking to a friend at the end of that evening saying, I don't understand the point of that. It's sort of depressing for the people. So yeah, your feeling was exactly the same as mine.
Well, what's interesting about the rehabilitation model, you see, Robert, and it's interesting if you've got that kind of job centre-ish background that dates back many years, you can relate to a lot of these models that maybe still exist. I don't know, I'm not as involved, but the rehabilitation model was introduced by the government really for people who were returning from the Second World War. The idea was that people perhaps had sustained or acquired new disabilities, and the rehabilitation service was there to help them with, primarily it was around physical disabilities and perhaps hearing loss, vision loss, those kind of things. And those rehabilitation centres were the kind of things that you and I would observe in the early 1980s. They'd never changed. And I saw things there that inspired me for my future work, because I saw somebody being trained to work in a retail environment, and they had this mock-up, almost like a 1930s shop, with all these kind of old cornflakes packets stacked up, and a very old-fashioned till that nobody was still using, and that's where they were assessing and training people to get retail work. So I saw all that, like you, thought, this model, there's something just not right here with this model. But you know, Robert, the Pathway Employment Service had been put together initially in the 1970s. And I think the lady who, and worth mentioning really, I think the lady who put that together, and again, I could be wrong, so forgive me if I am, I think it was called Val Cooper. And Val Cooper, my understanding was that she had been a day centre manager in learning disability services, and through that thought that a number of the people that she was working with as a day centre manager could actually get a job. And I think she convinced her local MENCAP society to change some of the funding structure so that she could become the first, if you like, employment officer, which is just incredibly radical for the 70s. And then
without Pathway, I think Pathway was the forerunner, and it enabled people like yourself to get into the job. And I think Pathway deserves a lot of credit, because when I started in Hammersmith and Fulham, there'd been a Pathway officer there, and they were the first people who'd got people with learning disabilities into employment. Absolutely. I think it moved on from there, but actually without that, there was no proof, and they managed to do that. And I think there was a lot of credit for that.
Definitely, that's absolutely right. just think that, you know, we don't probably sometimes remember enough of our history. It was definitely the MenCat Pathway Employment Service that, in my understanding and working in this field, they were very much first there. Now, that's interesting for me because when I got the job in Stockport, Robert, my job was slightly different. Bound to say that answer. It's going to sound really conceited, but the difference was from my other 15, 16 pathway officers. In the main, those pathway officers were referred people through their local MenCat society. So they were referred people with the backing, if you like, of parents and carers who were part of MenCat. Not necessarily people who were in the social services system.
I understand.
Yeah, I think I was possibly one of the first pathway officers whose service was funded through the local authority. And because it was funded directly through the local authority, excuse me, learning disability services, what actually happened with me when I joined in 1986 was that I was advised to set up my office with the community team, the social work community team. Now, this was a brand new idea to have a community service. I mean, in those days, again, forgive me, but it's called a mental handicap team. So
I know there was some appalling words used.
And
back in those
what they
days.
were called. So it was the community mental handicap team, and that team that was a mix of social workers and health service workers were based in a long stay hospital in Stockport called Offerton House. So this was one of the institutions that was going to, over time, close through the brand new community care legislation, where theoretically long stay institutions were going to close and people were going to be resettled into the community. So imagine, I've just joined this brand new Pathway Employment Services as their shiny new 20-something-year-old Pathway Employment Officer. I had this amazing person who was meant to be, again, very old-fashioned, meant to be a secretary, a woman called Sylvia Braid, who was we were like Batman and Robin, or Robin and Batman. Maybe she was Batman and I was her Robin, I think. But we were this brand new team. So Sylvia, I recruited directly, with just the two of us who were outsiders, who were suddenly parachuted in to this, what would now be called a community learning disability team, with an office in the long stay hospital. Now, although I've got a background in employment, Robert, I had no background whatsoever in learning disability, health, social care.
It sounds incredibly similar to myself.
You know, and so suddenly I'm part of this world. And so many influences from that, Robert, which may be very similar to yourself, because of course, once you start to work inside a long stay hospital, you start to see all the terrible things that brings to people. It brought terrible things to the residents who had been there for years and years and years and were extremely institutionalized. The staff were extremely institutionalized, and I saw things within the first few weeks that made me think, this is quite an abusive place to be, actually. And my outsider coming in head said to me, the sooner this place shuts down, the better it will be for everybody.
I don't think you can describe how bad these places were, where you would go there and there would be buckets of him and hers clothing, and bromide would be put into the tea, and cigarettes would be used as currency. They were basically prisons for people.
Oh, and it went much worse than that, Robert, because the nurses, some of them, not all, but some of them were like the worst kind of abusive. You know, I mean, there were, there are lots of things actually that probably are better left not talked about now, because I
No,
think
I
there's
think all we
plenty
can
out
probably
there that,
say quite easily they were horrendous places that
yeah.
really needed to move into the 20th century. Never mind out of the night. They were in the 19th century. They were awful.
It made me realise, Robert, actually, that whenever you segregate and congregate
Mm.
people because of any difference whatsoever, whether that's your race, your sexuality, your disability, I don't really care what that, your religion, when you segregate people and you congregate people and then you give people power over those people, nasty things happen. It's as
Mm.
simple as that. It does not make sense. It will never make sense to herd lots of people with drug issues into one block of flats and try and say this is how we're going to now count. None of that makes sense. None of it makes sense, because what you do is you create ghettos, you create a feeling
It's
of
interesting. Your feelings were the same as mine. I was lucky that when I applied for the job at Blake's Wharf, I was interviewed by a very inspirational woman. She was in her sixties at that stage, but she was very brave. She'd turned around to Hammersmith and Social Services, and she said, "Oh, she was going to be the manager of a day centre." And at the last minute, she said, "It's not going to be a day centre. It's going to be an employment service."
right,
She was
right,
fortunate as she was given a place which was going to be the new day centre, and it got turned into an employment service. So we were very
yeah,
fortunate that we were always an employment service right from the beginning.
yes,
So we
yeah,
we were incredibly fortunate. We didn't realize how fortunate we were
yeah,
until we met
very.
people like yourself.
Yeah, yeah, you were very fortunate. And so just to kind of bring this into how this then evolved into supported employment. So I was this pathway officer working for MENCAP, but funded through the local authority and based with local authority health service teams. Now, what was interesting about that although that was quite a shock to mine and Sylvia's system, because neither of us, as I say, had that kind of background, but it was incredibly fortunate because that team, that disability team, they were evangelical and pioneering.
Yeah.
Now, there is something about the northwest of England in those days that had these amazing connections with the United States, looking at some of the work that had been
Was it
done.
people like Mike Callahan and
Well, no, not strictly. There were a number of people, so not strictly speaking. So we had a social worker, for example, called Roger Fenton, who almost had a direct hotline to this guy called Wolfensberger
oh
in the
yes,
US,
I remember meeting him. Yeah, he came
right?
over.
Who'd been doing all of that work on something called social role
Yeah, it
valorization,
was called Pass and Passing and a number of
created all of
courses.
that, and then there was also a guy who worked not in that team but had contacts with that network in Stockport called Rob Henstock, who had very
Yeah.
similar connections with people in the US. So there am I, kind of in this completely alien environment, but meeting these people who just seem to be inspired to want to shut down these institutions that also had connections with people in the United States who were doing very similar work. So the kind of network that they had was a huge influence on me, if you like, crystallizing these thoughts that I had. I knew that what was going on, the way we were locking people away, was completely abhorrent.
Mm.
But I didn't have the kind of articulation to spread that message, if you like. And I think what social role valorization and getting involved and understanding that work of people like Wolfensberger, what that did, it gave me an understanding of how people had become devalued, the things that happen to you when you're devalued, what that means, how society reacts to you being devalued, and to some degree why you become a fairly easy prey to be abused.
Mm.
and to be seen as worthless and to be seen almost as non-human. All that social role valorization work that Wolfensberger did, Robert, was incredibly important.
Yeah, I remember going on a pass or a passing course, and also the 5As at one stage, and both of those were, I think, incredibly important, certainly for us in the 80s, to actually underline and spell out what we now call the social model of disability, and we look at that, but it actually spelled out exactly what was happening to people. I'll give you a real, in Hammersmith, there was one centre that called themselves the Last Chance Centre.
Yes.
And
Yes.
even how you name something and how you did something, and to make sure that you actually gave people a value. I mean, that's where we were fortunate in Jay Middleton, the person who ran Blake's Way. She said, no, when people come here, they need to come to an employment service and feel like this employment service is brilliant and good, and they are going to get a great service. And then you'd look around and all the other areas that they were involved in their lives, and you'd look and think, this is terrible for them.
Yeah, it is. And okay, so there I am based in the long stay hospital, and then my if you like, the liaison or the kind of main manager for the local authority then tells me that the expectation of the local authority on me is that I will start to take people out of their day service system and get them work. And the reason for that, Robert, there's a really simple reason for that. It's that the people who were coming out of the long stay hospitals and the people who were coming back to Stockport from other long stay hospitals, because don't forget, they were trying to close them nationally. So the people who were coming back from other long stay hospitals, they were heading into the day service system as well. And the day service system in Stockport at that time was full. So I then started to learn about the day service system. So you had every model that you could possibly wish to see in any book in Stockport at the time. You had the sheltered workshop model, full of people with disabilities. You had we had a place called Hope House. So mind you, in fact, the reason it was called Hope House, in fairness to Stockport, was it was named after Councillor Hope, who opened it. So, but it was Hope House. There was a place called Holly Industries, which was again a kind of like a sheltered workshop model. We had a place where people who were seen as being even more disabled went. They were seen as far too distant from work. So that was the old social education centre model, which of course was meant to educate people and actually just kept people in
occupied,
lifelong leisure and occupation, really, forever and ever. So we had the social education, the atypical day centre, we had a sheltered workshop, and those were the places where the pathway service, i.e. me, was meant to go in and to bring people out. So I went into these day centres to meet the managers and nosed around these places. And they were as abhorrent to me as the long stay hospital, because I looked at them and the behaviours of both the staff and the people in them were unbelievable. Now, again, I have to thank, to some degree, meeting people who had learned about this idea of why people become devalued, social role valorization, how people react to people who are devalued, etc. It kind of helped, Robert, because if I'd have not had that understanding, it helps you to work out what's going on. So you're quite right about things
I think it was so important, because when I started in '86, which is the same time as you felt a little bit that you were on your own. And that there was no actual, we were actually making the book as we went along. And to have someone to say, okay, we don't know about employment, but we do know about actual values. And I often talk now about values, about how important having that sense of values, even if you don't quite understand what you're talking about in the values, that you've got it inherent. And I remember when I met you in 1988, I also met another organisation across the border in Yorkshire, in Sheffield, called Interwork. And it's
Right.
quite nice at that time where I was suddenly seeing other organizations when I was talking to the likes of yourself,
Yeah.
where you were mirroring what
Yeah.
I was thinking. And I suddenly realized, actually, I'm not on my own. There are
Yeah.
other people. And I think that was that starting of that, what I would call the movement of supported employment.
Yeah, it's hugely important to have those people around you, Robert. I mean, I was very lucky because of that team in
Yeah.
Stockport that was so, if you like, committed and well versed in it. Their commitment to closing down these institutions, Robert, was unbelievable. It was genuinely evangelical. So, in many ways, that was a shock to my system because I was definitely the outsider. But I quickly latched on to why they were so evangelical about that mission. It was a mission. It was as simple as that. It was a mission. They wanted people to have better lives. They wanted people to just get out of these institutions and be able to live a life out there with the rest of us. That's what they wanted. And I started to get it. But you know, I was just very lucky because we had people in the Northwest, psychologists, occupational therapists
I
who were
also think in the
really,
Northwest, you had a lot of people starting mirroring what you were doing. If I remember rightly, and I can't remember the total dates, but I remember the beginning of the Association for Supported Employment in Manchester, in some sort of smoky hotel in Manchester. And I
right.
remember people like Phil Sykes in Oldham and
Yeah.
Jacqueline or Jackson. And then there was someone in Colin in Macclesfield, and the
Right.
Northwest. I always felt it tended to be London and the
Yeah.
Northwest for a while, where that was where the supported employment movement in Britain, I think, was starting to actually become.
Yeah, and I think the other thing, if we're looking at genuine history, I mean, certainly had a big impact on the Northwest, the Wales, because the
Yes.
all Welsh strategy for, again, in those days, mental handicap, the all Wales strategy was incredibly forward thinking, way ahead of anything that England and I
Mm.
think Scotland were doing, way ahead. But again, in the Northwest, we have some really good connections through the health service colleagues with people who were working on that kind of thing as well. So I was just very fortunate. But the issue then, Robert, was, obviously going into the day centres and looking at taking people out of there. I mean, the first time I walked into one of the day centres and saw something like 100 people crammed into this place, I've got to be honest with you, I walked in that day centre and I thought, I can't get anybody here a job.
Yeah, yeah,
It
I
was
understand
just
that.
so frightening. The behaviours were just so unbelievably abnormal. I don't believe that day centres now would be quite so
No.
different, but it was just an unbelievably chaotic place where all kinds of behaviours were just allowed. And again, what did I learn about that? Because ultimately, what I did was I got through to some human beings in that day centre, met them, got to know them, no fancy background with it, just got to know them, got to know their family, won their family over to the idea that this person might want to give something outside the day centre a try by way of work, and eventually got to them. And that was with a lot of support, again, from people like occupational therapists who, when I ran out of the day centre, they shoved me back in and said, no, there are people in here who want to work, so I've got to credit them with that. But they shoved me back in, and I eventually met some people and got over that barrier and just realised that actually what you've got in there, when you wiped away all those strange behaviours that were really reinforced by the staff,
Yeah.
totally and utterly reinforced by the
Oh
staff.
gosh, yes.
When you wiped away all of that, what you had was some just really interesting folk who wanted to get out and try some new things, and that's where I came in. Now, The Pathway Employment Service, just to get a bit technical, was a really good model. However, because what it was, the pathway model was what you now call natural support. What I was meant to do was to go in, get somebody a job, and then get somebody from the company to act as their mentor, guide, spiritual advisor, whatever in that company. The issue became, Robert, over time, as I got more and more people into work, and I convinced more and more employers to take people on from the day centres. The people that I was placing from the day centre, and there were occasionally people we placed from the hospital as well, they needed more support than the employer could give. That was the issue. Now, I was meant to have this thing, as I say, very old-fashioned phrase called a pathway secretary, Sylvia. As I say, I was Robin to her Batman, and she wasn't a secretary. She was already going into these workplaces and
so she was me starting as a job coach.
She was already starting as a job coach, exactly. Now, through people like Rob Henstock, I also got to know, quite apart from the social role valorisation, all the stuff about trying to make sense of how people do get devalued and what you can do. Of course, what's important about social role valorisation is the whole point of the role issue is that if you give people a more valued role, then society will be more accepting. They will be much more inclined to include people if they're an employee, if they're seen as a husband or a wife or
look how many people we place into work, and at the beginning they're talking all about them, and they're talking about disability, and very, very quickly they start talking about the person as a person and the fact that they support Man United or Arsenal or someone else. And very, very quickly they become another colleague. It's not surprising.
I don't think it was such a huge learning curve, but the first few people I placed from the day, well, here's an example. So, okay, you've got this guy who's got really quite challenging behaviour in the day centre. And one of the issues with this young man in the day centre is that he comes into the day centre and he carries with him every single day a bag filled with his toys, right? This is a grown adult man who's bringing a bag of toys into the day centre, and the day centre staff do nothing whatsoever to try to convince this young man that that's not actually adult behaviour. Right, so he's been doing this for years, been bringing his toys into the day centre. Nobody can take this bag of toys off him, allegedly, because if they do, they're going to get physically assaulted. Right, so there's the background, there's the story. I get this guy a job. What's the first thing that he drops when he goes into the employer? The bag of toys. Why does that happen, Robert? Why does he suddenly decide he doesn't need those toys anymore, but he needs them in the day centre?
Well, because it's not a crutch, and it's not a crutch for him, and also no one else is actually wanting him to have that. It's very quick and very easy.
And that just proves everything you can do. You can do as much research and reading about SRV, social role valorisation, and what, but there's the proof of the pudding. You see, if you treat people like children, if you all of those kind of things. It's not that long ago that I went into a day centre for adults, and the whole place was filled with pictures from Disney, full of Disney characters from, I don't know which film it was. And you just think, what's all that about? It's not that long ago that I saw pictures of people in a day centre that still have a bring your pet in to, and there's a grown woman there stroking a rabbit. Well, that's okay if that's her pet. But it wasn't her pet. It was a pet.
No, it's trying to make day centres into a children's place. It's just not on.
And there's a whole bunch of other things that go with that, but we haven't got the time. But
when you were at Stockport, you moved from the pathway. It became when I was there, you were more or less describing yourself as a supported employment service. And
that's the next bit, Robert, because that's what happened through people again like Rob Henstock. Rob Henstock had introduced me to this notion of the other person who wasn't in my life, but featured in kind of moulding me the way towards the kind of employment service I wanted to deliver, was this guy called Mark Gold and Associates in the United States. great. And Mark Gold wasn't living by the time I came across
No, we've
him.
still got the YouTube of him, haven't we?
Yeah, he developed this thing called systematic instruction, training systematic instruction. And Rob Henstock, again, had all these connections. There was another woman in Stockport called Oksana Machuik, who knew both Mark Gold and Associates and also knew Wolf Wolfensberger really well. So all these people, again, were a great influence to me. And what I realized through them was that the way, although it's really good, that pathway model, if you can sustain the natural supports, of course, that's the best way. But for a lot of my people, it just wasn't enough support.
Were,
So
were
I was
you on that 1988 course that Mark Gold came over, that two people from Blake, Sarah Wooding and Gillian from Blake's went on, and there was I remember there was probably about 10 people across Britain. I wasn't one of them. I was back at Blake's getting people into work, but Sarah Wooding went on to do that with Gillian
That's
and in
exactly.
Blake's.
I think probably Robert that Rob Henstock had been on that initial. I think there's
Right.
either 12 or I think there were 12 people initially in the UK
Yeah.
that met up with Mark Gold and Associates trainees. No,
That was pivotal, I think.
Yeah, it was, and I was, funnily enough, in the second wave of that training because there was another guy that I'd then met. In Liverpool actually. So I'm getting things out of order. So I was looking to the United States then at their way of doing things. This thing called supported employment, where they had job coaches that were trained in TSI. And basically, I went to both MENCAP and Stockport Council and said, which is a bit bold really, because they could easily have said, well, if your MENCAP model's not working, then we'll just sack you and we'll get somebody else in. But I actually introduced them to this idea of supported employment. And I have to say again, MENCAP were really very adult about that and said, well, that's not our model. But if Stockport want to create something based on that model, we'd be more than happy to hand the service over. And it was actually Stockport Social Services who said that I could join them and create a brand new service, which I think we called WorkLink, a brand new service. This was, I remember the date really well because I left MENCAP on the Friday, and literally on the Monday started something called Stockport WorkLink, working for Stockport Council. And that was the first time that we were able to employ employment officers who went out and looked for work.
And I think probably that was a time I came over to meet you.
Yeah, it will have been in 19. We've only got to 1988.
I know.
But yeah, it was. That was the first time that I think you probably came over just at the outset of us moving from MENCAP to becoming.
I think actually I want to talk a little bit about that, is when we were all starting off and that sort of, we were all forming, and although you've never actually been a big part of AFSE and BASE, I do think that you've been a big part in the fact that BASE has been a movement because of your help that you've given at times when you underwrite to make sure that Hugh, as a chief executive, was paid. I think there was a time when there was a need for us to start joining together as organizations, because and I think that was that for us. I think it was in the early 1990s that started happening.